Kids expressing their feelings during lockdown. They're sad, bored, worried. Doctors say their mental health is at stake.
Without the coronavirus, I could play outside, go for a walk, and go to school. But now I have to stay in quarantine. Even the little son here is sad. I'm awfully sad because I can't see my friends. I can't go outside. I can't do anything.
Adults are suffering too. Many have lost their jobs and need assistance from food banks. Their daily struggle to make ends meet is a mental strain. Dentists in France say patients are grinding their teeth more often. They're anxious about the crisis. Then there's the mental well-being of health workers. They have to deal with so many deaths, even their own colleagues. All the time worrying they could be next.
The United Nations is warning of a mental health crisis brought on by the coronavirus. It says governments need to take immediate action. Millions of people are suffering from psychological repercussions, especially those closest to the pandemic.
Her name is Nabila Germani, and she's been fighting coronavirus on the front lines in Albania for more than 2 months. That's enormous personal sacrifice.
I have a 15-month-old daughter. I also have a 10-year-old son, and I have parents who could be at risk because they also have other health issues, and that scared me.
At this Washington, D.C. food bank, the hardship is economic. With millions laid off and school meals gone with the lessons, families are also struggling to cope with the mental stress brought on by hunger.
It helped to me because right now I'm struggling with a child and I don't have many food stamps left. It's getting to the end of the month, so every little bit helps to keep the house going steady.
Now the United Nations is urging governments to be proactive.
The COVID-19 pandemic is now hitting families and communities with additional mental stress. Those most at risk are frontline health workers, older people, adolescents and young people, those with pre-existing mental health conditions, and those caught up in conflict and crisis. We must help them and stand by them.
Psychologists in the UK are trying to help, creating a number of cartoons to help families manage the additional strain of lockdown.
All the early signs, a lot of families are struggling. That's not a surprise, really, when you think about it.
Members of this support group for people suffering from depression or bipolar normally meet on Bondi Beach, but social distancing rules have forced them online.
People sharing their own stories makes you not feel alone, you know, that it actually puts some perspective on your own life. And I think perspective is really important, certainly in these times now.
And it's a fresh outlook that international bodies say is now vital to ensure COVID-19 doesn't leave millions more struggling with mental health problems.
Dan Chisholm is a project manager for mental health at the WHO. Dan, some dismiss the importance of mental health, especially with so much more to tackle right now, stopping the virus, helping those struggling financially. But isn't it true the costs of psychological support skyrocket when left unaddressed?
Of course, the mental health aspects of this COVID outbreak and pandemic are enormous. I think the first thing I'd say is that we're all affected by it, and that includes emotionally and mentally, but to differing degrees. And so some people may just feel quite naturally concern and fear, but others really are maybe struggling more and become very stressed, or even have a diagnosable mental health condition like depression or anxiety. And of course, we know from previous work that this has a huge economic or financial impact, not least in inability to work. So actually would say that it's really important to invest now in good mental health services, and counselling, online support, hotlines, and other supports to actually prevent an even bigger cost occurring in the future.
But what if you don't have access to professional help?
Yeah, so there's a range, as I say, of how people might be feeling and what they need. And many of us can actually get by with some information, psychosocial kind of information and guidance. Also, many countries already established some hotlines for people, let's say, including frontline workers, other people who feel like they need to reach out and speak to someone. That's not a high cost issue for them. Of course, many countries also have functioning mental health services which people can avail themselves of. And of course, with increased use of digital or online services to provide that scaled up level of support.
What about people who had problems before the crisis? I mean, surely lockdown would just make things worse for them.
Yeah, that's a very good point. So people with pre-existing both mental health conditions, but also physical health conditions are, of course, amongst the vulnerable groups. And this crisis may have exacerbated or worsened their symptoms that they had before and maybe had under control, and sort of maybe has made it much worse. So this would be a group that particular attention and services need to be aware of that and in contact with those individuals so that they get the support again that they are likely to need at this time.
Just briefly tell me, if you're having problems with your kids, how do you know if they're just a little sad because they're missing their friends or if they do actually have mental health problems?
Yeah, they've obviously, like the rest of us, been very disrupted by this. And you're right, it may be just that they're just feeling a bit, unused to not seeing their friends and being at school. But there are some clear signs and of more significant sort of distress, and that would include, losing interest in the things that you usually do, being more irritable or aggressive, not being able to sleep so well. These kind of symptoms or signs, and I think this is where parents really have an important role in keeping spending quality time with the kids and noticing any appreciable differences. If you see those over a couple of weeks, then it'll be good again to reach out to your healthcare provider to seek advice from that source.
Dan Chisholm, thank you very much for joining us today.
You're welcome. Bye-bye.
Now over to Derek Williams, our science correspondent. He's been looking into some of the questions you've been sending us about the coronavirus.
Why is it so important to detect patient zero, and how can researchers find him or her?
The current assumption is that SARS-CoV-2 jumped from animals to a human sometime at the end of last year in China, likely in Hubei province. Detecting that infection event is important for a range of reasons, not least because it can provide information on how and why an epidemic is born, which might help us prevent similar events from happening in the future. But following the clues back to the very first case in an outbreak is extremely complicated. We'll likely never be able to track the COVID-19 pandemic back to a particular individual.
Studies are coming out on COVID-19 patients who have vitamin D deficiency. What do they say?
You're probably referring to a recent paper from U.S. researchers connecting vitamin D insufficiency and acute outcomes in people who contract COVID-19. The D vitamins are those key compounds produced in your skin by sunlight. Anyway, this study looked at the issue from two different angles. First, it sought to answer the question of why proportionally so many African Americans were coming down with severe forms of the disease. And second, it posed the question of why many people who tested positive at a homeless shelter in Boston had few COVID-19 symptoms. The researchers connected those two dots with vitamin D insufficiency, which is very common in African Americans, and at least in theory is much more rare for someone who's homeless and spends lots of time outdoors exposed to sunlight. The study still has to go through peer review, and the sample size was too small to constitute really convincing proof, but the research certainly seems worth pursuing.
Are there government strategies in place in Germany for when and how to act if the second wave strikes?
Officials at Germany's Federal Disease Control Authority have said a second wave is nearly certain, and that the only way to avoid it is if the country's population acts responsibly now to prevent fresh infections. One step being taken is a planned voluntary contact tracing app to increase testing in people who might have unknowingly been exposed. About 2 weeks ago, the German government also decided that if the rate of new infections in a district rises above the threshold of 50 people per 100,000 inhabitants inside of a week, local authorities have to present strategies for containing it. If appropriate, containment measures could be limited to a single facility, like a rest home or a school. But if the reasons for the outbreak and the infection chains are unclear, the containment measures will be expanded to the regional level.